In this lecture, we will review the topic of interpersonal aggression. Defining aggression is difficult in part because the word is used to describe many different things, from a persistent salesperson to a rude comment. Let's start by defining aggression as any physical or verbal behavior that is intended to harm another person or persons or any living thing. This definition implies that an aggressive act may be intended to cause physical harm, such as a punch or a kick, or psychological harm, such as posting hurtful comments on Twitter or any social media outlet, or both. We generally apply the term violence only to acts of aggression with more severe or lasting consequences. But now let us review the role of intention. This definition emphasizes the intention of the person committing the act. If a person intends to harm another person but isn't successful, we would consider that an aggressive act. Likewise, aggression is impressed with a deliberate failure to act. When a lifeguard applies painful pressure to someone's chest in order to help her breathe, we wouldn't call this aggression because the intention is to save a life. Still, there are cases where the role of intention is blurred. Now, what if a woman bites her male romantic partner on the neck during a moment of intimacy? She is intending to cause pain, but whether or not it is an act of aggression depends on whether or not her intention is to harm him. Now, aggression can lead to many forms of harm. When acts of aggression are physical, the harm can be in the form of pain, suffering, injury, or death. Non-lethal types of physical violence, such as rape and assault, can be psychologically traumatic to the victim, leading to general feelings of anxiety, sleeplessness, nightmares, irritability, self-blame, emotional detachment, difficulty concentrating, and humiliation. An act of violence can shatter a person's normally secure feeling that the world is a safe and orderly place. In extreme cases, post-traumatic stress disorder or PTSD may occur, a syndrome that can extend these negative reactions over many years. In short, many acts of violence change the victim's life forever. So to recap, aggression is any physical or verbal behavior or deliberate failure to act that is intended to harm another person or any living thing. This definition emphasizes the intention to harm rather than the consequence of the behavior. Harm from aggression affects not only the victim, but also loved ones, witnesses, and sometimes the broader community. Now, aggression can take two forms. One, the affective form. Emotionally driven actions where the intent is to harm. And two, the instrumental form. Actions that do harm, but the intent is to achieve another goal. So, is there a link between biology and human aggression? There are parallels between humans and other species when it comes to using aggression to gain advantages and protect oneself and one's resources. The DACC region of our brains is activated when we experience injustice, insults, and other threats. Regions of the limbic system help generate fight or flight responses to perceived threats. And higher testosterone levels correlate with more aggression. There are many advantages to being non-aggressive, and humans have many evolved cognitive and emotional capacities that often curtail aggressive impulses. Humans also have the greatest capacity to kill because of our technology. Conversely, humans also have the greatest capacity for self-control. Now, let us review situational triggers of aggression. Unpleasant, frustrating experiences arouse hostile affect, which makes us prone to aggression, particularly when situational cues prime aggressive conditions. So, frustration, aggression, hypothesis. Let's review that one first. Frustration produces an emotional readiness to aggress. Conditions of the situation can then trigger an aggressive response. Displaced aggression is aggression directed at targets other than the original source of the frustration. Targeted displaced aggression is targeted against a secondary, even minor source of frustration. Now, let's review factors that increase aggressive responses. Aggression is more likely if the frustration seems arbitrary rather than justified. If there is an expectation of physical or verbal attack, insult, or social rejection. Aggression is also more likely when in response to physical pain, heat, and discomfort, and also if the individual has residual arousal from prior events. Stimuli that arouse hostile feelings are most likely to lead to aggression if there is a situational cue, such as a nearby weapon that primes aggressive conditions. And morals, empathy, and consideration of consequences can mitigate the effects of hostile feelings and conditions. Now, let us review the topic of learning to aggress. Please review my video learning lecture on social influence and violence in the media. But as a species, we excel at social learning, sometimes including how to aggress. For example, experimental and longitudinal study shows that watching media violence contributes to aggression. This is especially true when the hero is being rewarded. Aggressive and frustrated people are more susceptible to the influence of media violence than are others. Also, family life. A violent family life disrupts psychological security and models aggression. Rejected or abused children are more likely to become aggressive themselves. Lastly, culture plays a huge role in learning to aggress. Individualistic cultures tend to have higher levels of aggression than collective ones do. A culture of honor or code of the street may encourage aggression that is regarded as necessary to protect one's livelihood or status. There are individual differences in aggression. Individual differences affect a person's tendency towards aggression. First, let us review the gender differences. Men and women differ more in their mode than in their overall level of aggression. These differences are influenced by both social roles and biology. There is also a trait aggressiveness. Some people are high in trait aggressiveness. Maltreatment and stress during childhood may also contribute to genetic predispositions towards aggression. And on the issue of intelligence, frustration and misunderstanding may contribute to aggression in low intellect individuals. Aggression can also impair future intellectual functioning. And lastly, let us review personal traits when trying to understand individual differences in aggression. Narcissists and those with low and or unstable self-esteem are more likely to retaliate with aggression. People with under-controlled impulsivity also react aggressively, and people with over-controlled impulsivity aggress when hostility boils over. So, what are the roles of alcohol and other drugs in aggression? Altered states can contribute to aggression. Drugs contribute to aggression because illegal businesses' activities are often regulated through violence. Drugs can increase arousal and create a sense of paranoia. The most commonly used drug besides caffeine is alcohol, and research supports its casual role in aggression because 1. It impairs higher order thinking. 2. We expect it to lead to aggression. And 3, it impedes a potential victim's ability to read social cues. Aggression has many causes, so there is no single, easy way to reduce its prevalence. However, some approaches do inspire hope in reducing aggression. First, there are societal interventions. Large-scale efforts to improve quality of life, better control access to weapons, punish aggression more effectively, and better address media violence. There is interpersonal approaches such as to improve parental care and strengthen social connections with promoting empathy. And lastly, there are individual approaches, such as to improve self-awareness and self-regulatory control, to reduce hostile attribution bias, and to promote stable bases of self-worth.